Dr. Eleni Estathiou reported today at the ESMO Congress in Madrid a study on candidate predictive androgen signaling signature in patients with castration-resistant prostate cancer. In a previous study, you identified an endocrine androgen signaling signature, which is related to benefit from abiraterone acetate in patients with CRPC. Could you explain what this signature is and why it is important to have a predictive test?
Thank you very much for your question. In fact, we have been performing such studies that are based on bone marrow biopsying serially on patients with metastatic castrate-resistant disease treated with the novel agents. And this is the fourth in-line trial that we are reporting. On the first one, as you mentioned, with abiraterone, we were able to discover a more crude androgen signaling signature that comprised of the overexpression of the androgen receptor, the N-terminal androgen receptor, and presence of CYP17, the target of abiraterone. That correlated very well with higher level of androgens in the marrow as well, suggesting that it is indeed very much aligned with an androgen signaling signature that is paracrine and correlates with outcome. Further on, we went to look at the same signature in a trial with enzalutamide and confirm the same data. However, we were able, and we just published it 6 months ago at the European Urology, to see that there was an association of resistance with presence of splice variants. In the third experiment, clinical experiment always, where we treated patients with both abiraterone and enzalutamide and presented at this year's ASCO, we were able to refine this signature and actually combine the expression of AR-C terminal to AR-N terminal and create a ratio that, if it was close to 1, would mean full-length androgen receptor, combined with the overexpression of the N terminal and the presence of CYP17. So we are now, in this presentation given today at the ESMO, are applying this signature that we have refined to 170 patients who have been treated with abiraterone acetate prospectively. The results are supportive of the original signature that we had developed, so it is a testing method in a way, but it is in no fashion a validation of the correlation as a predictive marker. The next thing that needs to be done is, in fact, design a trial where we will combine this androgen signaling signature and use it as a predictor of the outcome, and that is actually our goal.
So can physicians already use this signature in daily practice to predict benefits from abiraterone or enzalutamide?
Absolutely not. I would really recommend, though, that physicians and investigators embark on similar studies. And in fact, my point being that it's becoming more and more of importance to biopsy patients who are diagnosed with metastatic and castrate-resistant metastatic disease, especially if these patients are developing visceral metastases. I think we're learning that this is feasible. We will come closer to precision medicine development once we're able to integrate a molecular characterization of this disease with the clinical data. We are not there yet, but all efforts are being made from a lot of investigators across the world.